So we're going to talk about anterior pelvic tilt. So this is where your pelvis is tucked under, and then you see you get an excessive arch in the lower back, and then your belly pushes forward here. So what's going to happen here is you're going to have really tight and overactive hip flexors and lower back due to that pelvic tilt, and then you're going to get really weak and inactive core and glutes. So if you see here, you get that excessive rounding in the back and then that shortening the space there, then that's going to feel really tight, and then the chest is going to be really high and the stomach push forward, so then your hip flexor is going to be really shortened and really tight and weak. So as we said with anterior pelvic tilt, from that you're going to have really weak and inactive glutes. So what we want to do is work on doing what we call a glute bridge. So with this, we initially want to change your pelvis into a neutral tilt. So that's tucking your pelvis under, making sure your lower back is touching the ground. Then you're going to push down through your heels and you're going to lift your hips up. Again, keeping that nice neutral pelvis. So we're going to squeeze your glutes as you push up and also squeeze your glutes as you come down to then help obviously strengthen your glutes and making sure you kind of understand how to keep your body in that neutral position with your pelvis. As we said, you're also going to have a very weak core when you have anterior pelvic tilt. So we're going to do another exercise called dead bug. With the dead bug, you're going to lie in a similar position with a glute bridge and tuck yourself into that neutral pelvic tilt again. You're going to raise both your legs up and both your arms up, and then you're going to alternate one at a time, bringing the opposite arm, opposite leg back. This is going to help cause instability, which will then strengthen your core. Always make sure your lower back is on the ground and your pelvis is in that neutral position. As you lower your legs, if you feel like your belly button is popping, your lower back is lifting, reduce the range in terms of when you're bringing your legs down. As well as strengthening exercises, we also need to stretch out those tight and overactive areas. So first we're going to stretch out your hip flexors. So if you come up onto your knees, have a box next to you if you need for balance, and you're going to bring your leg out in front of you. And then what you're going to do is kind of push your hip forward, so then you kind of feel that stretch. So as you can see here, we're aiming to stretch the left leg of Sergio, and that's going to stretch the hip flexor. So lean forward, but making sure you've still got that neutral pelvis as well, and you'll feel that stretch down the front of your hip flexor, maybe into your quadricep as well. Lastly, we're going to stretch your lower and mid back. So as we said, you're going to have tight overactive lower back due to your pelvic tilt. So we're going to get into a tabletop position. Make sure your hands are below your shoulders, knees are below your hips, and we're going to have that nice neutral spine. So at the moment we've got a little bit of a curvature, so we're going to change into that neutral spine. And then what you're going to do is, once you've changed into that neutral spine, engage your core, and then you're going to roll back slowly and try and get your hips towards your feet, and then bring your arms out in front of you and feel that lower back stretch. As you get more flexible, allow yourself to ease down slowly, breathing into it, and increase the stretch in your lower back.